I never felt joyful when my daughter woke up in the morning because she
Yeah.
never slept. And that just tainted a lot of my like excitement about being a mom.
Yes. Yes.
Because how many moms are out there listening to this? And I want this emotion to come through.
Yes.
I'm mad as a mom. Mind you, I knew my education didn't prepare me for that. I should have learned.
Hello, and welcome back to the Push Pause to Heal podcast. I'm your host, Dr. Emily Rodersheimer, and today I have a very special guest. Dr. Bahar Esmaili grew up in Iran and immigrated to the United States when she was 20 years old to pursue her dream of becoming a dentist. She currently focuses on the connection between oral and whole body health. More than just a practitioner, she is a passionate educator, I think you'll see as we talk today, and goes out of her way to help her patients understand the why behind the what of the issues for which they're seeking help. She is a certified personal trainer specializing in posture connection and is passionate about interconnectedness of the human body from the head and neck posture to jaw joint alignment to facial muscle tonicity and gait. It's all connected. In light of her profound realization that straight teeth cannot function on crooked faces, she is on a mission to enlighten practitioners of all kinds of their ability to impact compensatory mechanisms that ultimately lead to the breakdown of our bodies and our health. She is eager to inspire patients and professionals alike to join her on her journey. So happy to have you here, Dr. Bahar.
Thank you, Emily. Thank you for having me. Excited
Yes.
to bring some of my expertise to your audience, and hopefully we can put something in their bucket list of things that they need to learn today.
I would love that. Let's just start. You shifted gears, much like I did, and we have a similarity in that way, kind of from the conventional model. Can you tell me what led you to see health differently and kind of that journey that you took?
What, Emily, the more I do podcasts with different groups that had all similar journeys, and you're right, our synchronicity and energies brought us together. The more I do this, the more simplified this question becomes because that comes up all the time.
Hmm.
What led us outside the herd of mainstream? Because we all had one thing in common. We never learned how human body actually functions because all of us got allopathic silo driven training, and our practices have been limited to the initials after our name. And the more you practice in isolation, the more you see you cannot, your things don't resolve in your area. And the question that some of us dare to ask, that maybe some of the other providers don't ask, or they're not interested in learning about, I don't know which one it is. The question that keeps coming up for me was, why am I still seeing the same problems come up? Why am I seeing repetitions? And why am I not able to help my own child with breathing disorder? And she's 7 years old and keep running into the same system that trained me. And I thought, push pause, what am I missing here? Where we're running into a system that basically tells us bodies operational in segments. If you're a dentist, you fix the mouth and you don't really have much to learn about their other parts of their bodies. The
Sure.
only area where dentistry is connected to medicine is when it comes to gingivitis and blood pressure. Refer them out. And when sleep apnea started to really make its way to my world because I want to be a TMJ specialist, I understood practically everything I've been treating in dentistry was one way or another a connection to a disorder of breathing, whether it's neurological, orthopedic, whether it's from a sleep standpoint, it is all related to the mouth. And I didn't know at that point, I go from the state of not knowing what you don't know. It's bliss. That's when you're like day in and day out, your brain is parked outside, you go to the practice, pick up the drill, do what you do. And then you question that. And you no longer can do what you did before because it's not working most of the time.
Yeah.
I would bet 100% of the time it's just that devastation was not as much for some that it was for others. And then you don't know how to do it right. So do I have a career or do I not have a career? That's a very, that period of time that lasted almost 5 years for me is the time that you're trying to relearn. Unlearning and relearning, it's so much harder than learning in the first place without a bias. So
Yes.
here I am, 5 years later.
That's
I
amazing.
still don't know what I want to be when I grow up. I just want to learn more how body works.
Well, I think we'll be learning forever. And I think that's as it should be. But what a amazing just little synopsis there that you gave. And really, I think kind of the tie that I see with clinicians who have left the kind of the allopathic training or conventional model is that there's generally a either personal or family related situation. For myself, it was my own rheumatoid arthritis, but for you, you have a story of your daughter was struggling. Yeah. Do you mind sharing a little bit about that?
I mean, my Melody, she at age 2, I knew there's something not working with this kid.
Mhm.
Snoring, ADHD type symptoms, sugar craving, grinding her teeth, large tonsils, audible breathing. I mean, all of it just adding up. So I run to the first pediatricians every year after year,
Yeah.
comparing like, yeah, she's fine. She checks the mark. We have this bell curve and she's right in the middle. So we have, I'm like, but they don't check for breathing. They don't check for any of the things that is like really concerning to me. So when she was
Mhm.
3 years old, the first time I remember going to someone to help me was an ENT. My kid is not sleeping. She wakes up at least 10 times per night. She wakes up groggy in the morning. They call it terrible two, terrible three. Like, when is
Right.
this? Why? Why is this child never excited about waking up? And she's been grinding her teeth. I mean, I could hear her clenching it. And as a dentist, it's like rubbing my soul.
Yes.
And I could see her tonsils are getting large. I knew there was a relationship between them, but I wasn't sure what that was at that time. And I said, can we do a sleep test? Oh, no, no. What are we going to do? Like, the tonsils are not ripe enough. And that's really the stats
Oh,
with the
wow.
otolaryngology. They do watchful waiting. They don't remove the tonsils unless they're like grade 3, 4. And they at that point, they would send the child for an in-lab study, which is really expensive and a hectic process. And for a 3-year-old, it is
Oh,
horrendous. Getting them
yeah.
all wired and
Oh,
glue in their head.
miserable. Yeah.
I mean, right now that I treat patients and children, I have
Sure.
much better way of doing sleep tests. That was not back then, 6 years ago. And actually, it's not 7 years ago, in
Mhm.
2018. And so I was like, well, at this point, I've got to find out a way to help this child. And nope, nobody would run a sleep test without justification.
Mhm.
So first ENT sent me home with the Flonase. An orthodontist I consulted because she has this, her face is shifting and her mouth is just grinded down. Okay, I'm just a general dentist. Can we do
Yeah.
something about the snout? The orthodontist come back when she's 8. Everybody's like waiting until she's 8 years old. What happens between age 4 and 7, Emily? The biggest part of our facial growth and development happens between the time that we stand up, we walk, chewing functions between 4 and 7 is majority of our facial growth happens.
Mhm.
That's the time that's important for children to not just breathe through their nose, but to have a proper tongue function and proper chewing mechanics, and whatever systemic issues you're dealing with need to be dealt with prior to that. But optimal time is at birth, if not before, because 4 to 7 is when hit the ground running. They need to
Mhm.
grow their face because permanent teeth are coming in, their mouth and jaw need to grow. And she missed all of that. So I'm seeing the signs, but what do I do? Come back
Right.
when she's 8. What do we do at 8? Because she would have permanent teeth. We can shove them around and take out teeth to fit them in. The focus was never about getting her to grow. The focus was to get her straight teeth when she's between 8 to 12. And by the time she was 6 years old, the symptoms have elevated to a level where the school was eager to put her, or preschool, eager to put her on ADHD meds because she's not sitting still,
Yeah.
fidgeting all the time. She's lacking sensory integration. She's not getting full night of sleep. She's not restful because she's
Oh,
never gotten fully oxygenated. And I don't know the first thing. So
yeah.
at 6 years old is the first time I demanded. This is the second ENT and pulmonologist I'm consulting at that point. I'm demanding a home sleep test. Or sorry, not a home, that was not an option. A
Sure.
sleep
Sleep test. Yeah.
pretty expensive and a hefty process. We went through that and she came back with AHI, apnea hypopnea number of 10. For anyone listening to this and they don't know what that means, that's a number of times that you stop breathing or your oxygen drops for at least 10 seconds per hour. One of those events for a growing child is devastating. She had 10. I
Wow.
mean, to think about as a parent putting it in perspective, it's not like I wasn't looking for care, but nobody
Right.
was directing me where to go. And I'm lost, and this child is dissolving in front of me, is developing symptoms over symptoms over symptoms. And mind you, when a child is not going through a deep stage of sleep, the devastation is multifold than an adult. First of all, their growing brain needs oxygen and deep, restful sleep. When you
Okay.
have constant arousal and constant disruption in sleep, which is inducing hair grinding, they will not get the full night of sleep. So everything that's depending for their growth, development, right brain, left brain
Yeah.
connections, all halted. Second devastating effect is this child, when they're not getting a deep night of sleep, their body's in a state of sympathetic overdrive.
Mm.
Their connection to their other humans as they're trying to grow up and learn the world is all they're in survival. which cause a lot of behavioral and ADHD type symptoms for starters. It's not the only reason, but it definitely contributes to it. And when your body's in a sympathetic drive and constant arousals, cortisol and insulin drive go up, which compounds the effect on the child's microbiome and their gut function. So sugar craving is all of that is explained. When you're not sleeping well at night, your body is running on cortisol. They constantly are craving a lot of carbohydrates, contributes to a lot of habits that they're driving, which even affects them more systemically from a functional standpoint, hormonal functions. Like this child was running with one foot on the gas, one foot on the brake. All the while I'm running to medical doctors with board certifications, some of them double board certifications to tell me wait till she's 8 years old. So at 7, finally we got the approval that, yep, tonsils are ripening up. I can hear her breathe across the room, amputate those body parts. Nobody asked why the tonsils were enlarged. Nobody was interested to find out why this child has large tonsils. Amputate them, that's the standard of care. And I did. I didn't know differently at age 7. And after that, September of 2017, it's the first time that, and my venture for wanting to be a TMJ specialist, I was led to first Airway course, pediatric sleep Airway. And I saw pictures of mouth that looks like just like my daughter. And I'm in tears. I should have known. I should have known. I never felt joyful when my daughter woke up in the morning because she never slept. And that just tainted a lot of my excitement about being a mom. Because how many moms are out there listening to this? And I want this emotion to come through. I'm mad as a mom. Mind you, I knew my education didn't prepare me for that. I should have learned. I should have had training about Airway. I was a practicing dentist. How many of these people were sitting in my chair? But the one person that mattered to me the most is the one that I failed the most. I channeled that energy towards, I want to become that doctor / mom for all the moms out there that they have their child in front of them. They go in doctor to doctor. Let me cut you slack. Let me redirect you. Your child is not breathing. They're not growing. They need so much more than medication. You're running to your friendly neighborhood pediatrician has never been told to check signs of dysfunctional breathing and sleep. It's not going to have this conversation with you.
No. Wow.
Never. So I wanted to become that agent, and here I am. Grassroots movement.
Wow.
Every post I make is about educating people. Let me tell you what. If you take care of your body, if you learn how to breathe, if you remove the burdens, which your body wants, your body can heal. Sickness is nothing but body. You know what I always ask, Emily? You know what sank Titanic? It was not the iceberg. It's when Titanic lost its ability to sustain itself afloat. We are constantly getting stressors from the world, and our bodies are adapted, called it adaptive capacity, adapted to deal with the stressors, is when we are overspending that capacity for fights we shouldn't fight, the right to breathe properly. And I'm saying the right to breathe and sleep. Our bodies are losing their capacity to adapt. Our nervous system is getting its sympathetic nervous system constantly turning on in response to things that should not be chronically present, like food, improper breathing, improper posture. Then when it comes to stressors like an iceberg, we tip over so fast. And then you run to the person that can deal with wherever your body gave up, whether it's a frozen shoulder or a TMJ or a broken tooth or apnea or heart attack. But then heart attack comes up and it's like, oh yeah, let's put them on medications. Why did they have a heart attack? We don't need to know. We just need to make sure that we keep them alive, put them on a bunch of medications. And that approach, as you and I know, for all those who hear, we have an awakening within us. And as doctors, we go back and remember we took an oath to do no harm and do our best in ability. And knowing that our education didn't prepare us for that, we're basically paving the way and creating the science as we go. So,
oh wow! Like if I could, I would drop my mic, but it won't sound so good on the podcast. Like that was excellent. I just want to say, like there's nothing like a mom with a suffering child who will just go to the ends of the earth to figure that out. And so I love that about what your story exemplifies. And I would say you really were there for your daughter. You ultimately found, right? I mean, you wish you could have done it sooner, but you ultimately found, and now you're changing the lives of so many more. And
I knew what really happened. I always found the answers 3 years too late. What I should do for my daughter right now, as she's 12 years old, is is I'm still picking up the slacks of what
Yes.
happened when she did not sleep properly, the
Yes.
growth and development that was halted. I'm still trying to undo the damages that was done then, as I should be preparing my 12-year-old for what she's going through puberty and peer pressure, and her face is now like growing. I should be focusing on that, not fixing problems that I should have been dealing with at 2 years old. It's like eating Oreo cookies while you're brushing your teeth. That's the
Yeah.
same way I see. I mean, it's
Yeah.
never you're never going to be ahead of the curve when you get a
Mm-mm.
child in full compensation and trying to figure it out.
Yeah.
And
Yeah.
yes, I had to completely switch my career. I completely left clinical dentistry in a
Yes.
mainstream sense and after 10 years of practice, because in my heart of heart knew not only that I have not been able to help anyone, I don't know enough to know where their disease is coming from. So 10 years to become a dentist, 10 years practicing only to live it and start over. So that's what it was,
God.
the cost for those who want to know, what does
Yeah.
it cost to be like you? You're just going to have to I left it. I mean,
Yeah.
400 yards of full stop, U-turn, figure it out.
Well, I give you a lot of credit for making the change because that's scary, right? To leave everything you've ever known is scary to do that, but it's that inner knowing. And I think you said this towards the beginning, like once you see it, you can't unsee it. Once I learned about functional medicine and that there's this concept of a root cause, like I couldn't unsee that. I couldn't continue to practice in the way I was practicing. It didn't sit with my soul. And I think that's how what you're describing as well. You
Yes.
just are such a wealth of information. So I would love to see, could you tell us, because I think my audience doesn't know, we know a little bit, but maybe not enough about what is the proper way to breathe and how can we like check ourselves for that?
So, just like everything else, and I'm sure you're in the world of functional medicine, a lot of things get trendy. So, people are now seeing things and say, oh, that's all I need. I just need some
Oh,
red light
yeah.
therapy and mitochondria support,
Yeah.
right? Okay. So, as much as I love the fact that people are aware of their dysfunctional breathing, but I'm equally disappointed that now they're thinking, oh, I just need to tape my mouth and I'm good, right? Mewing, right? So they're still seeing the tip of the iceberg. So going to functional medicine health, at the end of the day, breathing is a function of our nervous system. Breathing is the currency of our nervous system. So every breath is dialed to the state of your nervous system, mentally, physically, and yes, biochemically. Breathing is an exchange of gases, O2 and CO2, which a whole host of chemistry underneath is controlling that. Every system has its own pH management, and the pH management is at the mercy of the gas that we exhale, not oxygen. Oxygen is not the metric that brain measures, it's the CO2. So, biochemically, from a neurology and nervous system standpoint, like we know that vagus nerve is important for dialing our breathing, and which mechanics we use for decompressing rib cage, which is diaphragm, is really important for breathing. And yes, how air gets into our system, which means the face, the craniofacial development, the space in our mouth where the tongue is sitting. Are you able to breathe through your nose? Do you have patent nose, open nostrils, inflamed nostril, or narrow nostril, or both? If your face is narrow and your nostrils are too close, and on top of that, you have allergic reaction, let's say, to food. So your immune system function is low, which could be because of your improper breathing, but it could also be because of other things. So you have two things going on simultaneously. And then you tape your mouth. What do you think your body's going to do? What do you think your body's going to do? It's not going to be the end of the problem. So I see this winded answer for anyone listening and thinking, is there a simple way to address it? There's a simple way to get to know your breath, but to understand why your mouth breathing, or as I call it, sympathetic breathing, because mouth breathing is really what it is, sympathetic breathing. You're not properly breathing. It's just one way to know it is take the time to dial. So sit down. I don't want anyone to assume any different posture than they do because your brain will do what it needs to breathe. Just take 15 seconds or 30 seconds and count the number of times you breathe. Okay, first of all, if you're breathing, over breathing, that means breathing 20 to 30 breaths a minute. It's too many breaths. I'm not saying that you can attain a proper number of breaths, which is 6 to 8 breaths a minute. But if you cannot attain it, that tells you that gap equates a dysfunction. So if you're breathing upwards of 30 breaths a minute, your body is exhaling way too much of that CO2 that you need for properly using the oxygen. Even if every hemoglobin in your body is loaded with oxygen, if you do not have the proper amount of CO2, you do not have access to that oxygen. That's not up for discussion. Oxygen is carried through this mechanism through hemoglobin. It's like getting buckled into the conveyor belts in a system, like when you see in the roller coasters. There's someone that's going to come in and buckle you in at the beginning of the roller coaster, and someone's going to buckle you out at the end. That person, that conductor, is CO2. So oxygen is sitting right there ready to be delivered, and hemoglobin is hugging it. CO2 is what's needed. So if you're over breathing, that gas is going to determine how oxygenated you are. And one of the most important tissues in your body that needs that is your brain. Because if brain is not getting what it needs, it will immediately change the rate and the depth of your breath, which means you cannot win half your way into better breathing. You cannot tape your mouth and tell your brain to shut up, because the brain needs to dial sensitivity to CO2 before you can dial down to the proper number of breath. One of the main reasons why, Emily, I see people are over breathing is because it's coming from their state of biochemistry, mental state of their mind, which may have altered because of the orthopedics, the alignment, or a combination of factors. And by closing the mouth and dialing down and counting your number of breaths, you're like, okay, now I know I'm over breathing, but why? Well, the answer for everyone is different. It could be 1, 2, 3, or all combination: mental, chemical, physical, chemical, biophysical, or orthopedic, or a combination. To understand the why is way more vast. And hey, you want to try and see? Try to take a deep breath. Do you go to your chest to take a breath, or you just are able to descend your diaphragm all the way down? Anyone that wants to take a breath and goes into the chest, the neck breathing, the upper chest and neck breathing is one of the major factors of why we contorted posture, low tongue posture, because if you have to breathe through your mouth and you cannot dial your nose breathing, you will have a forward head posture. If you have to dial your breath down to so many breaths a minute, you have to shallow breathe from the upper chest. You have to be forward, right? That's causing a lot of anxiety for the brain as well. So the answer is much complicated. But if I tell somebody right now here, you want to know if you are or you're not, count the number of breaths. Are you breathing 6 to 10 breaths, or are you breathing 20 to 30? If you're over breathing, you have a problem. Now, where that comes from, we don't know. But
Right.
just knowing that you're over breathing is the first thing you need to know.
Excellent. Excellent. Good. Okay. And you're looking at how the airway is connected with the entire body. So you'll see actually things in the pelvis or other places connected to. Can you tell us a little bit, how does that work?
I always love to take things all the way down to the basic knowledge. And I tell you what, Emily, when I started learning human body function, I went all the way down to the embryology, which was something we all learned in medical dental school.
Yes.
2 weeks, memorize everything, spit it on paper.
Right. Forget about it. Yeah.
No, 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 no. How did we form? Because if I want to write a human manual on how to do human, I've got to go back to how we were formed. And a few things I discovered from the embryology was the way our faces and our mouth and our airway formed. So we were one cell at one point, but then one cell had to become a bunch of plasmatic cells together, clumper, and the clumper formed the neurotube. The neurotube became nervous system, the neural tube, and then from there proprioception was formed, and our entire organs and tubes formed. So we are a complex system, a bunch of tubes that carry fluids and air within us, and they all are at the control of our nervous system to do so. Kind of like a city that has a governing system, has highways and what have you. Those tubes that carry air and fluids, one of them is obviously our air. So when we are trying to move things within this system, this cruise ship, Titanic, our human body, we need pressure gradient to make it happen. So breathing at its core is a pressure gradient change. We have air outside and air inside. The air inside of you is different than the air outside of you because it's within your body. That's our airway. For it to stay open and move air in and out, we need to have constant creation of positive and negative pressure against barometric pressure. So air comes in, at some point, as the diaphragm descends, the pressure outside and inside becomes equal at one point, and then the pendulum goes back to the lung would coil in, and then the diaphragm goes back up, and this becomes an automated system. We shouldn't think about it. It should just happen by itself in our brainstem. So our brainstem gets information on how to dial this down. So yes, barometric pressure is one of the information. Obviously, the CO2 and O2 is another metric, the chemical measure, and which muscles needs to be compensated to match the best state of bringing that to happen. So if you cannot properly breathe with the right rib cage and pelvis mechanics to descend the diaphragm passively, you've got to use your upper chest, right? When you're using your upper chest and neck and accessory muscles, brainstem is constantly needing to, because again, these are not muscles that are automated, they're compensatory muscles. So means your neurochemistry, the chemical sensitivity changes as your posture has adapted. So proper orientation of our diaphragm with the pelvis is the bare minimum requirement to have a passive movement of diaphragm. So if your rib cage is outward like this, like shooting out, you have a curvature, deep curvature at the bottom of your spine, your pelvis and your diaphragm is winging out like this instead of being parallel. That means you cannot produce that pressure needed to properly breathe. And I'm talking breathing, not respiration, just to get the air. So what happens if you don't have a stable pelvis to aid with that? You will have to resort to neck to breathe, which means even though we work on typing your mouth, get the tongue at the roof, you open your nose, everything works in the upper airway. But what happens on the bottom requires that stability. Now, I work with a lot of different providers from the bottom of the spine, from the toes all the way to the cervical spine and the cranium itself. We have different providers that work with different segments that are not working, so we address them in the right order, kind of like the Titanic. If the fluid that come into the ship, right, its balance is addressed at the lower level, it wouldn't tip off the balance even further, because the more you compensate, the more you compensate. And the goal is not to address the breathing only at night. I don't treat sleep apnea. I treat breathing disorder against gravity. I let what say take care of itself, because if you can breathe with the proper pelvic diaphragm activation, proper tongue posture, nose, rate, chemistry, neurology, heck, we don't have a disease. Disease happens because your body loses its capacity to function properly. That's a functional airway thing, I guess that's what we can call it. So, yes, we need the proper pelvic mechanic to breathe. Yes, important.
Yes. Wow. Well, this is really like the interconnectedness is so important. And I think you're exactly right. We're not, generally in life, there's not one root cause, right? There's lots of things happening. Everything is impacting everything else. And so we have to take the airway and our ability to oxygenate our tissues very seriously, because that's without oxygen, we know that we don't function very well for very long at all. So as you're telling us about this, where would you have somebody that's interested in learning more about their airway or this process for themselves? What's a good starting point?
I know people are in different walks of life suffering from many different dysfunctions in their nervous system. And this is why I love talking to a lot of naturopath functional medicine, because we're all focused not just on the breath directly, but more on the nervous system. And this is even how I run my clinic, which is completely interdisciplinary. We're about to add a functional medicine arm to our clinic. Mental health needs to be another branch, because when nervous system dials out of vagal and rest and digest, the breath is impacted. And I do know orthopedic alignment is one of the major drivers just from the alignment standpoint. So addressing that is something that we have perfected, but that's not even the starting point. To me is, first of all, the least minimum thing somebody needs to do is running a survey on their body. How do I feel when I wake up in the morning? How do I feel throughout the day? Do they have general fatigue syndrome? How do I take on the stressors in life? Where do I go when I have stressors I can't handle? And where is it that I snap quicker when there's the stressors coming? Because every time our bodies go through stress, our breath is impacted. Every time we have inability to adapt, we are dysfunctionally breathing. So narrow that down for you. Is it when I have mental stressors that I panic breathe and I feel like I'm stressed out? Or is it when I eat some certain food and my digestion is the one that pushes me there? Or perhaps sitting down too much and having a sedentary life. If I walk every day, if I do my stretches and movements and I'm able to move, hey, I don't have a problem. Or I can take on more stressors. Dial it down for yourself. I'm literally giving away the pearls right here. If your credit score is 650 and say, hey, what I'm going to improve my credit score because I want to go take on another stressor called the home loan, right? That's a stressor. It's a good stress. It's a used stress. But a good stress. When I want to open, I would say, all right, let's take a look at your credit score. Oh, it's 650. That's literally how we do our things in our clinic. We have our first station of diagnostic is not sleep test. It's not posture. It's not your breath. It's CBCT. It's your nervous system. We dial you to this system called heart check, which is a measure of heart rate variability and autonomic nervous system. It gives us the overall score, 82%. What does that mean? It comes from 3 credit bureaus, literally, mental, chemical, and physical. Okay, which one of them are reporting poor?
Yes.
Well, you can open 10 credit cards and you maxed out of all of them. You want to buy a house? Go pay those off, take a loan at a lower rate, and the long term, pay off the credit cards, and your score is going to go up. That's the equivalent of saying you're eating really poor diet, your digestion is suffering, and you're overusing your serotonin. You do not get enough melatonin, or you're not getting conversion of melatonin, so you need support there. Yeah. Or no, oh my gosh, your posture is the driver because top to bottom you are imbalanced. Okay, that's what's draining your credit score. Because when we are flipping the pages in our report, it tells us where's the likelihood that this nervous system has been activated into sympathetic, causing the symptoms. Knowing where to look first, where the storm set up shop for you, that's the first thing. And I cannot answer that question for anyone. Sure. Yeah. I always ask them, the first 10 questions I ask is, where are your stressors coming from? How do you adapt? And where do you snap? Because if you can narrow that down, it helps me to know where do you need the most support. And so I think putting all of our focus, and I go to a lot of functional medicine biohacking conferences, and I hate the word say biohack as in just foo-foo stuff. Really, they're just longevity, life improvement, and they all are focusing on biophysiology. It just is so baffling to me that they come and listen to a dentist talk about what if your head is postured improperly and if your lower jaw is back, it physically limits your vagal tone function. And your low vagal tone cause all these problems down the street. Yes. There's only so many peptides in the world that can address or CSF flow limitations. I mean, that's a mechanical problem.
Oh, for sure.
And those are the things that they are not addressing. And anyone listening to you or me separately in our podcast, they would say, oh, all I need to do is just get a bigger mouth and tongue taping, what have you. No, wrong and wrong again. Maybe that's all you need. But what if you have 2 other things that force you to be a mouth breather, that make your mouth not grow, which they're still there? If you had allergic reaction to a food because you didn't have genetic factor to process, cause inflammation in your nose, your face grew long because you had allergies to something. What if that's the reason? I can grow your mouth, expand, and I'm using air quote.
Yeah.
And cut your tongue, get it at the roof, all of that. But you still are fighting battles. You still have inflammation that's not resolved. How do I know that? I'm not your expert. Neither do they have a breathing problem, an orthopedic problem. Would you be the expert? The fact is, Emily, the closer we are in knowing human bodies, nervous system reasons for inflammation and sympathetic overdrive, the better we can direct them. And that's a dream I have. If I have a utopia to live in, I don't want to use the word health or disease. It's where the language we speak is where's your voltage, where's your adaptive capacity? How can I make it cheaper for you to do human? That's the language I speak.
Oh, cheaper to do human. I love that.
I mean, I want to help humans do human better. We don't have a manual. Honestly, our manual is incomplete how to do modern human.
No, for sure. Yeah. And it's so true. Like a lot of my clients they are just like Band-Aids on everything to get through the day. They can't eat these 12 foods and they have to like do all these things to sleep well. And it's a lot of work to just like maintain. Whereas we're ultimately looking for how do we resolve the things that are driving that so that we can live optimally. I love that. I'm going to join you in your utopia, if you don't mind.
Listen, I mean, this is my ultimate wish and will that in every city, our practice where we are just rebranding as we're talking. It's not about oral appliances. You're not coming to only meet a dentist. You have three chiropractors in three areas. We have physical therapy level care. We have reflexes and emotional health. We have functional medicine, nutrition, diet, lifestyle, and at some point, like I said, mental health and releasing trauma because
Yes.
it's called Center for Breath and Beyond. Because when your breath is at the mercy of your nervous system, don't come to one provider and have all the answers. No one have all your
No,
answers.
no.
I don't know anything about what my patients are coming through until I listen to their nervous system. When I say, oh my gosh, you're better off to talk to someone that can do a lot of emotional trauma release because your hippocampus does not have the memo that you're no longer a 2-year-old in an abusive
Yes.
home with an alcoholic
Yes.
dad.
Yes.
And you cannot sleep. Your body still doesn't feel safe. You're
Yes.
still running through those cortisols. It's not because of your airway problem.
Mm-mm.
You're
No.
sympathetically breathing because the tiger never showed up. You're still waiting for the tiger. And how do we find that out, Emily? I mean, this is joy. What I do is so joyful because I'm not terrified of complex patients because we become their partner. We
Yes.
learn about your body as you learn about your body, and we figure this out. It's so much fun to tell people, I don't know. I really don't. We're gonna figure it out, right? You don't come to me because I have the answers. You come
Right.
to me because we have a place to look at you deeper, to learn. And then I think that, yes, I will take you. Please join us. More functional health providers to embrace
Oh,
this.
I love it. I love it. If somebody does believe that they have an airway issue, I know that you work with the Vivos device. Can you just tell us, because I do think there are people with sleep apnea or other issues that don't know about the power of this device, and it's something that is used across the country.
Yes,
Yeah.
absolutely. So, how is Vivos different? So proud. My journey of 5 years of living clinical dentistry has woven into my new career with Vivos. And this clinic that I just mentioned is our new venture. It's our new division in Vivos, as in we're embracing the entire body
Mm.
and providing a home for other medical doctors. So, Vivos' story was we started to treat airway from what everybody can see, the space in the mouth. And our appliances are the only oral appliances in the market that have been cleared by FDA for addressing sleep apnea, obstructive sleep apnea in adults and children from mild to severe. This is the only time in history that FDA have given a clearance to any device other than a traditional mandibular advancement device that most dentists are familiar with. So our appliances are designed to not only give lower jaw a homeostatic position to allow the prevent the collapse, but
Mhm.
also stimulates and advances the space for the tongue and the room in the mouth. The cranial facial aspect of growth that was missed is what we have proven. And most of those patients are personally treated for this clearance. And we've shown that we can actually resolve their AHI, sometimes upwards of 60 episodes an hour, down to like single digits. And this is
Wow.
tremendous because we're not just band-aiding and babysitting a disease, we're giving the body a chance to properly own the spaces to breathe, address the
Wow.
nasal breathing at its core. So if they want to find out more about Vivos, vivos.com, you can learn more about Vivos there. And if you want to come see us at Center for Breath and Beyond, they can look us up on my and directly from my Instagram, they can get a patient form signed because not only that we give them a DNA or Vivos appliance, we're also providing all this auxiliary treatment to make the progress
Yes.
even
Yeah.
better. And we're working around the clock to make this available in every zip code. But at this
Wonderful.
point, we have oral appliances, we have trained providers all over the country. We're now getting medical offices, we're requiring medical offices so we can provide this at sleep centers to patients.
Nice.
So, mat devices, I hate to tell you this, it's not a band-aid. It's a roadkill. CPAP itself, it does not address the why. It just maintains the disease.
Mhm.
But I'm glad to report, even if we are not 100% resolving the case for every patient, almost everyone gets some level of results. 30% of our patients are reporting their symptoms are improving, their nasal breathing improvement, which means quality of life, the other two-thirds. So I hope that I answered the question.
Yeah.
Children devices are even easier because they're pre-made. We help and aid with tongue posture, growth and development, and facial development for children. And it does not require braces. That's the best part. If I knew this when my daughter was 3, all it would take is proper tongue training, just proper alignment, and getting her to breathe. That's it. I didn't have candidiasis back then to deal with. I didn't have 7
Yeah.
cats to feel it. She
Yeah.
hasn't worn her teeth out. If you're a parent listening right now and you have a 1-year-old with snoring and dark circles and long
Mm,
face and mouth breather, take it seriously.
mm,
Consider this your warning. Go check it out. That's not
yeah.
normal. And there's
Yeah.
people out there, they are trained, they have devices that are super easy. And if your child grows, here's the best part, if you want an incentive, if your child's mouth and face grows, they will not require wisdom teeth removal or braces. How about that?
That's a
Get
huge
them
savings
growing.
right there.
Growing. Get them growing.
Yeah.
Do your child grow and all these teeth get crowded in and crooked. And then what? We need more room in the mouth.
I
So
think what you just said there is there's such simplicity that we miss, right? We miss it for chasing all the fancy devices, tests, whatever treatments. And it can be as simple as starting at the basis of a really good airway in early life.
exactly. Because if they
Amazing.
cannot breathe, their bodies will compensate
Yeah.
in every level it can.
Mm,
And and it comes at, in some cases, it comes at a hefty cost because lack of proper sleep and lack of proper breathing leads to a whole host of functional health that you see. Like a lot of children that have down the stream problem with
mhm.
digestion, vagal tone, it's because their sleep is disrupted.
Sure.
And doing a sleep test is not difficult like it was for me. We literally have a simple ring we put on a child's finger. We could do screening, see how much oxygen they're getting, how many times they're waking up.
Yes.
If it is that simple and cheap, they should not. Every parent needs to know this. And I'm hoping every one of these podcasts I do, I get to reach to somebody out there and
Yes.
says, you just described my child. Where do I go?
Yes.
Go find a doctor who's trained, an airway dentist, someone who knows
Excellent.
how to do Vivo's appliances, someone who knows what the role of the tongue is. Don't try to convince your orthodontist, like I was, that my child is grinding their teeth. Don't hold your breath that every orthodontist would know how to address this because they
Mm,
don't. We go
mhm.
to our friendly neighborhood ENTs and orthodontists, and I exhausted 5 of them, exactly 5, and
Wow.
I still had to go back and do it right.
Yes. Yes.
So
Wow. Well, thank you so much. This has been amazing. I would love to ask, how do you take care of yourself? Because I this is the Push Pause to Heal podcast where I try to invite high performing women to make sure they're checking in on themselves and pushing pause in a way to feed their soul and not just take care of the world. And you're on a mission like I'm on a mission. So sometimes my mission can drive me too quickly, to push too hard. I have to really check myself. I'm curious if you have a way in your life that you push pause so you make sure you're taking care of yourself as well.
I'm gonna start the answer with more of a cliche answer. In the airplane, what are we told? Put on your own mask first, right? And
Yes.
sometimes we forget that
Mm,
you can pour from an empty cup. And
exactly.
we get so sidetracked by now I know this is my spiritual gift. It's no longer just my
Yes.
job, it's my
Right.
spiritual
Right.
gift.
Yes.
And when I come to when one of the biggest joys I have is when I help another human nudge them in the right direction and see their bodies unwind. Yes, it's joyful. But one thing that has been tremendous for me, and I want to share that with all the moms out there again, this is my
Yes.
mom hat, not my doctor
Yes.
hat. Sometimes it's okay to take a day off, turn off your phone, and just
Mm,
say, what? I need to center. And I do
yes.
this a lot because the more of dysfunctions that I see in this world, the more I take, and I'm a very empathetic person,
Mm-hmm.
the more I want to jump and help everyone. But I forget sometimes the best thing we can do is not just grinding ourselves in the process trying to help 2 more people,
Yes.
because in
Yes.
that same time, once we actually spend the time to rejuvenate, work that I do like this, I take the time to share my gift. I by far help hundreds more than I would
Yes.
do trading my time. So do an inventory of your own time. What am I doing,
Mm,
spending my day-to-day life doing? And as much as I'd like to say, it is so much fun for me helping 2 more people, sometimes just stepping back and turning the phone off, taking a
mhm.
social media fast,
Yes.
taking a fast from your email, and rejuvenate. Take the time to stretch. Go outside and see the sunshine.
Yes.
Breathe. Slow down your breathing for 2 minutes or 5 minutes every day, preferably right after you wake up and before going to bed,
Mm.
and see your life change. Take the time to focus on your breath because nothing else matters. Your breath is who you are. Focus on
I
it.
I love it. I love it. That was perfect. So, is there anything you'd like to share that you haven't about how people can reach you. I know your podcast is wonderful, If Your Mouth Could Talk.
If
And
Your Mouth Could Talk is a
yeah,
great resource, and
I
if
love
you're on
that.
YouTube, the Airway Architect is full of information and how learning more. If you want to learn more about how I do things and see me in the clinic, there's a lot of videos we prepared for patients.
Yeah, you do.
But main avenue is most people are on Instagram. Social Instagram is our main avenue where people kind of find us, and you go to the main page. You can make an appointment right there from the form, or you can visit our website, like I said, Vivos. But at the moment, we're establishing our new clinic, so we haven't published our website for Center for Breath and Beyond. But the Airway Queen, you can go to Airway Queen, the Airway Queen, and Instagram, and you can make appointments. If you DM us, we will reach out to you. And if you heard this podcast and you feel like there's something valuable that sparked in you, it would be selfish not to share it. Please hit that share button, share it with a mom, a parent, a community, with your school. There are people at school that they don't know these children that are on ADHD medication. They're all, probably most of them are mouth breathers. I could venture and say, tell them about it. When we plant the seed and when it grows, somebody's life can change and you get the joy.
Well, I just have nothing else to say. You said it perfectly. Thank you so much, Dr. Bahar, for your time today, for your wisdom, your guidance, your inspiration. And I know that my audience is going to be changed by this conversation. And yes, we will all follow you on Instagram. I will say I already follow, and it's great. So jump in there, and thank you so much. And hopefully we can chat again sometime.
It was my pleasure. Thank you for having me.
Mm-hmm.